Thank you, Mr. President. Speaking to the amendment. I strongly urge the ladies and gentlemen of the Senate to support the amendment offered by the esteemed Chairman of Finance. I understand that change is scary, and whenever we move forward, there's always an element of risk. But I have to say, if somebody sits back and looks at how our current healthcare system is working and how irrationally we now allocate care, on balance, you would have to come to the conclusion that we have built-in protections and this is a risk worth taking. Right now, the nearly 400,000 people who would be eligible for coverage under this expansion are getting care. Our society and this Commonwealth believe that individuals, when they're ill, should have access to care. But we're not doing this in a sensible way. They're going to emergency rooms at a point in their illness where they are probably most sickest, and it is most costly to care for them, and their outcomes are the worst. This makes no sense. Our hospitals and our safety net programs are caring for these individuals, but the only way they can afford to provide that coverage is by passing the cost along to each one of us through higher premiums. I have a letter from our Inova, which is the prominent provider of healthcare services in Northern Virginia. And of course, the director, Knox Singleton, states quite clearly that businesses are really paying the cost of this uncompensated care because the premiums that they have to provide for their employees are going to continue to go up. And mind you, these individuals are not getting good care. They don't have a medical home. They're not getting primary care. This doesn't make sense. We should change it. I also want to say on another point, people have talked about all the income or dollars flowing into the state as a result of this. We should really pay attention. The last statistic I saw, it was going to cost Virginia only $137 million over 10 years, yet we would access $29 billion in federal funds. Analysts have told us that this is a lot of money. Not that we have to be told that, but guess what? With all this money, there's a lot of economic activity that goes along with it, and a lot of jobs. And those jobs will be created in parts of our state where we have high unemployment, and we also don't have a lot of access to care. I think that's a win-win. There's another group that did an analysis and said for every day that Virginia does not participate in this Medicaid expansion program, $5 million of Virginians' taxes, federal taxes, go to support a Medicaid expansion program in other states, such as Ohio and Arizona, just to name a few. I guess I would conclude, Mr. President, by asking my colleagues to think long and hard about how we want to not only treat our fellow Virginians, how we want to help the business community do the right thing, how we want to support our hospitals and our social safety net, and how we want to create jobs in the Commonwealth. I urge your support of this. Thank you.
Thank you, Senator.